All right, so today we got Dr. Wilson with me and Dr. Hannegan. We're going to talk a little bit about where does sports chiropractic fit into the sports injury hierarchy. Dr. Wilson, where do you think chiropractic should fit into the hierarchy of when someone gets an injury?
In my case, and my theory is when you're an athlete, injuries are always going to come and go. No matter what sport you play, at some point you're going to get injured, even if you're everyday Joe. Based off your specific injury, it can categorize you into different places of treatment. Why chiropractic or sports chiropractic works so well with other doctor offices is because we can triage and bounce a patient, if need be, to ortho if they need casting for a fracture, injections for any herniation, medication if needed. But if we don't have to take that major step, we can help you recover quicker naturally through our treatment plan, which can take different courses of action. We have a variety of different modalities we can use for an injury, and we just seem to get better results and quicker results than everybody else.
No, yeah, that makes sense. And really, just to add on to that, I mean, it's just like you have your primary care and then you have your surgeons, your orthopedic surgeons. And that's it. Typically, you go to either your primary care or you go straight to the surgeon. Primary care, nothing against them these days. They're just so rushed that they don't have an opportunity to really give a good evaluation. Pretty much it's take some ibuprofen. If it's not better, go see ortho or just go see ortho. And that's really a crazy step if you think about it, right? Because you're going straight to a surgeon. I mean, the percentage of injuries that need surgery are so low. We've talked a lot about it, and it seems like really chiropractic should either be the first step,
Focal point.
the focal point where you come straight into a chiropractor, or if you go to a primary care, we should be bounced to a sports chiropractor first and see if conservative care can treat the injuries first and then move it on to more invasive treatments. Your injections, your MRIs. Well, I guess an MRI is not really invasive, but more expensive treatment like an MRI. And then, surgery should be the absolute last thing. I think it would really save some money and time, honestly, for athletes.
I agree. Plus, we follow up with patients more often than your PCP or your ortho. So we can kind of get a better baseline, know where you're at prior to your injury and when you're injured and your post-injury. So we kind of have a lay of the land a little bit better.
As chiropractors, we're still doing a full orthopedic exam. We're going to run through, as sports chiropractors, we're trained and we're going to run through the exact same evaluation that you're going to get at an orthopedist. We're going to run through the same tests. We're going to determine probably the same things. We're going to order the same imaging if necessary. It's really going to be the same type of exam, except for we have more options. An orthopedist is going to be essentially your MRI, a boot, an injection, surgery, or PT, a muscle relaxer, an anti-inflammatory, that type of thing, which a lot of the anti-inflammatories you can take over the counter anyway.
Yeah. So I think what separates us differently than regular chiropractors is we have this thing, it's called a CCSP.
The CCSP, Certified Chiropractic Sports Physician, or in Kentucky here, we have to say Certified Chiropractic Sports Practitioner. Essentially, it is a postdoctorate program we go through that really goes through everything from on-field injury, similar to an athletic trainer. A lot of the tests at the end is very similar to their nationalized test. We learn spine boarding, how to deal with and manage a team on field, all the way up to imaging, reading the imaging, dealing with these things, taping, bracing, what other modalities to do post that, as well as just familiarizing us with all those types of injuries. And that includes concussion, which is one of the major hot topics in sports injuries right now. That really sets us majorly apart from your normal chiropractor. In standard chiropractic school, we didn't learn it. We get a lot more in that CCSP program. We learn a lot more about all the extremity joints, your elbows, your shoulders, your knees, your ankles. Even the two of us, we went to two different chiropractic schools, had significantly different experience with extremity joints in terms of adjusting. And that certification really normalizes the knowledge between the different schools and from the basic chiropractor.
I mean, it ties it in so well with chiropractic and sports because you're looking at the whole body and seeing how it moves and how it can dysfunction and how you can treat it and make it better, let it perform perform a little bit above optimal ranges and just improve performance.
And yeah, that kind of brings us into why should chiropractic be used as part of a sports performance program? And I'll touch on that a little bit first. So the reason to make that part of a sports performance program, you're putting all this time and effort into a coach here, a trainer here, all of this to make your body work better in your sport or perform better, higher VO2, higher speeds, higher strength. All of that relies on the body functioning properly. And that's where chiropractic comes into that performance aspect. If you're not having correct thoracic mobility, you're not going to get as much arm extension, as much reach back, and you're not going to be able to get as much velocity on a throw or a hit. That's just one example of how when you improve the mobility and the performance of the body structurally, how it can transform into your specific sport.
Same with golf.
Yeah, golf.
Golf swings. If you want to drive the ball further distance, work on T-spine mobility.
Yeah.
Stuff like that.
Absolutely. And weight training in the gym, if you don't have ankle mobility and the range of motion through that ankle, you're not going to be able to squat as much. You're going to be loading the body differently as you do that squat or that deadlift, and that can then lead to an overuse injury or a tear, where when you're able to distribute that load equally throughout the body and throughout the tissues, we limit the injury potential, but also maximize performance.